Well, we're back with Dr. Preece, dentist in Anchorage. Dr. Preece, talk a little bit about brushing teeth and flossing teeth. Soft toothbrushes, electric toothbrushes, flosses which are pure and clean, flosses which have wax on it. Tell us what's better or whether it makes a difference. Should we have toothpaste with fluoride in it? Give us basically the dental hygiene rundown here of what's important and what's not important.
Okay, thank you. First of all, a soft toothbrush is important. That is able to get the plaque off the teeth without harming the gums. Many people feel like it's not doing a good job. They're used to a medium or a hard brush, but in reality, the soft works fine, doesn't do any damage. You do have to replace them more often, but it's well worth it. As you're brushing your teeth, the technique is probably the most important thing, and the bristles need to be aimed at a 45-degree angle down toward the gum so that the bristles go down in between the gum and the tooth. That's the most important area. A person that's been trained properly on how to brush their teeth can do a good job just with a normal hand brush. But most people are in a hurry or don't understand the proper technique, and so for those people, an electric-powered toothbrush often works better. But there again, they need to hold that at the proper angle for it to be the most effective. Most of us are in a hurry, so that if we let the brush do the work and just get it in there by the tooth, that works out better. As far as floss goes...
well, let me talk a little bit about the proper angle and why.
Okay.
So you have this in a 45 degrees. So basically you're brushing half of your gum and half of your teeth or whatever. And the 45-degree angle, is that a little bit kind of like if you lift the carpet from, your floor and you hold the broom so that you kind of get the garbage out in between, which kind of goes under the first couple, 2-3 inches of the carpet. And is that what you try to do with your brush, to get out actually the stuff which is in between the gum and in between the teeth?
Yes, exactly. The plaque, the bacteria that's down, we call it a sulcus. It's a little cuff right around the neck of the tooth, and that's where the damage occurs if you don't remove that. And so if you can angle the bristles and get them to go down between the gum and the tooth, and if you do it in slow motion and look in the mirror, you can actually see the bristles go underneath the gum. And, of course, you have to just vibrate and use little circular motions. You don't want to scrub so hard you cause damage, but the proper angle and a little vibration motion works well.
Okay, good. You were talking about the floss. Interrupted you, sorry.
Oh, that's okay. Floss, it mostly depends on the person and how tight their teeth are. If you have a thin piece of non-wax floss, that works well for some people, but other people that shreds, so they need to use a wax floss or one that's Teflon coated, such as Glide is a popular one that's real slippery. They found that a cleaning action doesn't really matter. They all work. It's the scraping against the tooth that does the good. So find one that works well, that doesn't shred and get caught in your teeth. A lot of people like to use a little floss picks. They have a hard time wrapping the floss around their fingers properly, so they use either a handle that holds the floss or these little disposable picks that they can then throw away after each use. And that works well too.
Okay. All right. So let me ask you, so a person, and I'm talking about me here, let's just say a couple, 2-3 days for some reason, and I know it shouldn't happen, but again, sloppy people like me, it does happen. So for a couple, 2-3 days, no flossing is going on, okay? Mm-hmm. For whatever reason, go to bed late, work late, and just go into kind of fall in bed or be out skiing and just kind of whatever, not doing it. All of a sudden, the gums start bleeding when I floss again. But then within a day or two of flossing again, after 2, 3, 4 days not flossing, the bleeding is gone. Should I worry a lot? Is that normal, or does that already mean I have something going on in my mouth?
That's kind of a normal response. What's happened is that without flossing, the bacteria start to cause an inflammatory reaction and infection in the gums. And then within a few days of resuming the flossing, they start to get healthy again, and you don't have the bleeding. Anytime you have bleeding, that's not good. That shows that you have the beginning of gum disease. But if it's just in the soft tissue and not in the bone, it can be healed and corrected within a week usually of beginning to floss properly. The body's pretty resilient in healing.
Yeah, usually 2 to 3 days with me, 1 day, 2 days flossing, third day it's usually gone again if I have neglected it for for a little bit. So basically, obviously I shouldn't ever miss those 2 to 3 days, because it's amazing how, so basically what you're telling me is that gum disease is 1, 2, 3, bang. A weekend of neglecting, partying, and bang, there it is.
That's right.
My God.
But luckily the beginning is a reversible thing, so it can be healed up quickly if you get back after it again. Right.
Okay, good. Well, all right. Thanks a lot. Thanks a lot about the... Oh, by the way, I've lived in India for a couple of years, and almost everybody I met there, they had what's called a tongue scraper. And people scrape their tongue there. Now, I've seen a few people in the United States having it also, and then I know about other people brushing their tongue and their gum, and frankly, I do it at least most of the time. It somehow, feels refreshing. Is it anything more than just, I don't know, is it a good thing or bad thing? Is there something to it to cleaning your gum? Your gums and your tongue?
Well, it's a good thing. Lots of bacteria reside on that surface of the tongue, and if you can reduce the numbers by scraping the tongue, that will help your breath, for one thing, and also it will slow down the process of, after you brush and floss your teeth, of re-inoculating those surfaces with bacteria. So if there's not as many bacteria in your mouth, it slows down the recolonization process, basically. It takes a little longer for that stuff to get back on your teeth again.
So it's a good thing. People should do it.
It's a good thing. It's a good thing.
And the brush is okay.
One doesn't need to get
one doesn't need a
scraper. Yeah, a tongue scraper works well, but you can do it with a brush. And also brushing the roof of your mouth, same principle with the toothbrush is helpful too.
That's what I call the gum. Is that the same thing? No? Yes?
No, up in your palate, up in the top of your mouth, that area.
Okay. That's not the gums?
No, not necessarily. The gums are more around the teeth themselves.
I mean, yes, the palate, basically.
Yes.
Yeah, I got it. Okay, yeah. Oh, well,
okay.
That's why they call us laymen here. Thanks a lot, Dr. Preece.
Thank you, Howard.